You are watching the Doctalk show.
Discussing one of the most feared complications in pregnancy, excessive bleeding or obstetric history. Just before we went for the break, we got to know that excessive bleeding is a real danger to the life of the mother and has significant impact on the family and the community. So we want to talk more with our team of obstetricians in the studio to discuss ways we can prevent the problem from going out of hand. How can we prevent mothers from suffering from excessive bleeding? Is it just a matter of her making sure she sees the doctor, or are there some systemic issues that can also contribute to mothers losing their lives? So maybe I'll start with you, Dr. Sebuliva. Are there other ways, systemic issues that can prevent mothers from dying from these complications?
Yes, thank you, Dr. Darius. Yeah, we've seen that postpartum hemorrhage is a leading cause of maternal death. So meaning this has an impact on not only the mother, but the society and the country at large. So we all have a role to play. We've seen that the mother has to go to the hospital, but then the health worker also has a very big role to play. Health workers usually give an injection of a drug called oxytocin to help the uterus contract or tighten after delivery. And we should make sure all our hospitals, all health centers have these drugs in abundance and they are well stored. There are also other drugs that can be used. For example, some are actually tablets that can be used. Some of them are taken orally. And these can easily be given to mothers to keep them and to only take them after delivery.
After delivery?
Yes.
Especially those who opt to deliver at home?
At home,
okay.
Yes. So we would think there are various studies that are going on to see whether these drugs can help. Or
do they help? These studies, do they show that the drugs help?
Yes, some of them have. They are still undergoing, but some of the studies have shown that the drugs, if given at a community level, they may have a role to play to prevent postpartum hemorrhage, especially among those mothers who may be delivering at home.
Okay.
But then when we come back to the health workers need adequate training in order to recognize the mothers at risk and how to handle them and how to manage or even to prevent and manage postpartum hemorrhage. So we recognize that we have so many upcoming health training institutions. The institutions need to train their midwives, to train their other health workers who handle pregnant mothers adequately on how to recognize postpartum hemorrhage, on how to prevent postpartum hemorrhage, and even manage. The key factor here is when should a health worker who is at a lower health facility refer a mother. There are various levels at which you can refer a mother. You can refer during antenatal care. For example, if a mother has delivered several times, or more than 5 times, or 6 times, then this mother should not deliver at a health center too. Should deliver at maybe a health center at a hospital, or even a health center for where a cesarean section can be offered.
Okay.
Then when a mother delivers and she bleeds, and you recognize early enough that this is postpartum hemorrhage, you need to refer this mother immediately, not to wait for some hours.
Okay.
And remember, this bleeding is undergoing. So the more you wait, by the time they reach a national referral hospital, they have lost most of their blood, and some of the health workers may do nothing at a national referral hospital. The delay can be because of the decision made. They delay to make a decision to refer. Also, the delay can be because of lack of transport to the next health facility. So that's why we emphasize that our community leaders should make sure the ambulances have enough fuel, the ambulances are available to refer mothers from either a health center 3 to a hospital. Okay. And this referral should be prompt and in time. So you see that the community itself has a role to play.
Okay.
Yes.
So Dr. Masiko, at a hospital level and at a government level, what steps do you recommend to curb this problem of excessive bleeding in pregnancy?
Thank you. Well, in 2014, I did a study about the outcomes of emergency obstetric referrals to Mulago Hospital. And I discovered many things. First of all, their outcomes were really poor, and they have complications like the hemorrhage we are talking about. But then, there were many other factors really leading to these poor outcomes. So at hospital level, like we said, because the patient, if they have done their role of seeking health care on time, so the rest of the work is actually for the health worker to do to make sure mothers don't die from hemorrhage. And at a hospital level, like we said, if someone has had good training, we know what they call proper management of that third stage of labor. After delivering the baby, what should you do? Like he said, the injection should be given so that the uterus can tighten or contract, so that the placenta is easily delivered. It just peels off the surface of the uterus. But then there are other times when the complications are serious, like they may need operative intervention to a level of maybe someone needing removal of the uterus if all interventions fail. So in a hospital, like maybe a referral hospital, systems should be in place, that the place should always be ready to handle emergencies. There should be enough blood, for example, in the blood bank, because mothers come when they have lost a lot of blood and you need to replace it. But at a national level, when you say things like ambulance, in fact, in my study, there were some mothers where things like ambulances were available in the facilities they delivered from, which we are referring to a higher facility. But that goes back to the training Dr. Sebuli has talked about. Because there are some instances when you see, for example, a mother is bleeding, how should she be referred? Not just someone recognizing she's bleeding, then they just put her into the ambulance. And the ambulance would run that way. There is that delay to reach care. But during the referral process, what should happen?
She's in the ambulance.
Yes.
There's some treatment she's getting.
Exactly. Such a mother, for example, because she's losing volume, she's losing blood, would be proper like such a mother maybe has intravenous access, like she has a cannula, and even during the referral process, she's referred when she's on fluids running.
There's some care being given in the ambulance.
During the referral.
Okay. Maybe the other question is, are the ambulances equipped with these things?
That is the other issue I was going to mention, because there are some ambulances which are just carrier vans. An ambulance, a good one, should have resuscitation kits, should have oxygen on board, and all these things can be put up. Like the referral process should also be ongoing care.
It's
not
sort of like
just
a pre-hospital
yes.
in a car. It's not just
at a government level, if things improve, like there should be proper communication systems. For example, if a mother is being referred in a poor state from a peripheral site, even where she's being referred, they should be informed before she actually reaches. But you see here, a mother reaches hospital and they are preparing her fresh. Yet they would know prior to her being sent, and probably she reaches when the problem is known. This mother has a cervical tear, theater is ready. Yeah, so government should ensure functionality of lower health units, like health center force, which can offer these operative interventions, so that there is no congestion at the referral sites, because mothers can be referred and they reach the referral center but may end up with poor outcomes because they find so many mothers waiting to be worked on. Yeah, and also at the referral centers to increase the numbers of critical cadres like midwives. Theaters may be there, but sometimes they can't work without anesthetist. Yeah, and ensure like presence maybe of intensive care units at these higher level facilities, because some others may need to be saved at such a high level, like with intensive care. Even when they are being worked on, they can still end up with poor outcomes when there is no intensive care unit.
That attending antenatal care is very, very crucial. And of course, with partner support, it can help in decision making when it comes to when to seek health care, and also even maybe helping in transport from home to the health facility. And to the lower key health, the lower health facilities, the health attendants or the health workers, they should be able to recognize mothers with a risk of postpartum hemorrhage and do prompt referrals to the higher health facilities.
Okay. Dr. Masiko?
Yeah, thank you. Just to add, like we said, these problems progress rapidly. So mothers out there, if they get any bleeding and they think is more than usual, they should immediately seek health attention. Otherwise, if they wait, sometimes it's too late. Yeah, like we also said, the health workers maybe as improved training in the institutions so that they are able to recognize these problems and know how to help these mothers. Because we've seen the biggest part of preventing deaths from hemorrhage are for the health worker.
Okay, so we want to thank you, our guest doctors, Dr. Masiko from La Bridge Hospital and Dr. Sabaliba from Coimp Hospital for taking us through this very elaborate discussion on postpartum hemorrhage, or they call excessive bleeding after delivery. You've heard the risk factors, you've heard the message of prevention, what you should do if you, a mother who has just delivered a child, is bleeding too much. Contact a health worker, seek urgent care. Do not wait, do not postpone to say maybe you do that, you see the health worker tomorrow. Go immediately to the hospital and get adequate care, because postpartum hemorrhage or excessive bleeding is a real killer. It's a real danger in today's world. Very many people die of this problem because of bleeding too much after delivery. So we hope you've learned a lot from today's discussion. Send in your questions and comments on our social media platforms, on Facebook, on Twitter. In case you missed this show, don't worry, you can always go on YouTube, subscribe and like our handle, The Doctalk Show. You'll find the video uploaded there. So we'll see you next time on The Doctalk Show. Keep it healthy and keep it classy.